Hi everyone, this week's Clinical Pearl. We're going to discuss and see some novel ideas for retraining balance to prevent falls in people with chronic stroke. And we know from the literature that up to 75% of those living with stroke will fall, and that people with chronic stroke are 2 times more likely to fall than their age-matched norms of community-dwelling older individuals. In the interventions that we currently use, generally with the balance, strength, and endurance, there's a lack of specificity of training, meaning the motor responses needed to prevent a fall are not elicited or effectively modified during traditional exercise methods. This came from Haines et al. In 2019. Therapists are hesitant to put patients in situations that may elicit the motor responses, so those unexpected, challenging, higher risk situations, just because of safety concerns. Our patients need to be placed in those situations of complete instability that will elicit the true motor responses that are needed for preventing unexpected falls. When patients know what to expect during balance and perturbation training, the motor responses are definitely different than those when the instability is truly unexpected by the patient. So we know this from research. So in chronic stroke, those deficits that we often see, and this is probably a review for you, but impaired ability to recover from an anterior-posterior fall, delayed and reduced muscle responses from the paretic limb, the hopping strategy to avoid putting weight on that paretic limb, recovery steps that are shorter with more trunk rotation, and the inability to initiate a recovery step with that stroke side. There is evidence of improvement in recovery steps seen in studies that induce platform tripping mechanisms, in which treadmills or platforms induce sudden high velocity, large motion, loss of balance to cause an unexpected trip. But these are very expensive, upwards to $100,000 to have in a clinic, so most of us don't have that access to that. Perturbation training has also been found to be beneficial in Parkinson's, subacute stroke in older adults. So these are things like self-initiated perturbations. So let yourself fall back against a wall, bring yourself forward. The therapist, we often deliver push and pulls to help challenge our patients for that unexpectedness and see how they respond. Surface translations, waist pulls, lean releases are all other novel ideas that can help bring a little more unexpectedness to our balance training. One, good, back. Okay, so side, good, and back. Good, and back. Yep, good. And forward, so forward, good, and back. Side. Nice. All the way down. All the way down.
Okay.
Good. Now I just want you to come back down. Good. And then back up. Good. And then back down. Good. And then come on up. Good. And then come back up. Good. And then back up on your hands and knees. Good. And back down on your elbow. A lot of times the patient's fall recovery is also limited by confidence. So training fall or unexpected situations is going to be really important to improve confidence and self-efficacy in fall recovery. Here we've put the client through an obstacle course that is visually hidden to him. There are objects underneath the sheet that he knows he will be stepping on, but he can't anticipate what will happen when he steps on them until he steps on them, which is very similar and very unexpected. A novel idea used in this obstacle course is that we did cover the objects, but also at either end of the obstacle course, you'll see that we used friction reducing sheets. These mimic icy conditions. They do slide fairly rapidly, similar to platform perturbations, and can create that unexpected condition in which the client needs to recover from.
It was work.
Taking an obstacle course outside on unlevel surfaces is a great way to mimic those unexpected conditions that we're trying to retrain. Mike is a big football fan, so you can see that the therapists have integrated use of a football and a kind of a getaway game that Mike is extremely interested in and is having a good time. It's an inside obstacle course that Mike is working through, again, with the football because he is a huge Detroit Lions fan. And you can see that he actually loses his balance and has to practice his reactions. Notice his arm is the first reaction, which is not what we want ideally. So we went on to work on a better stepping reaction for him.